38 degrees, 421 here at NewsTalk 1400, DWS. Brian Moline with you up until 5 o'clock today, and pleased to welcome back to the show Dr. Scott Paluska from Oak Orthopedics. Dr. Paluska, how are you this afternoon?
I'm doing great, thank you.
Well, one thing that you hear about a lot is stress fractures and stress injuries of other types as well, but we'll start talking a little bit about stress fractures here today. Just, I guess, give us a brief rundown on exactly what a stress fracture is.
A stress fracture is a broken bone that's partially broken. So some people may call it a hairline fracture or a crack or a partial break, but it involves something that interferes with the outside lining of the bone, which is called the cortex, and extends in towards the middle and sometimes all the way through the bone. So as opposed to, say, a break or a fracture where you trip off a ledge and come down hard on your wrist, this is something that tends to develop over time, but it's in the same family as a true fracture, if you will.
All right, very good. And what are some of the areas of the body that tend to be most susceptible to stress fractures?
Well, the lower leg bone, the tibia, which is the big bone that connects your knee to your ankle, is the most common area. But the lower extremities in general are where people tend to accumulate more of these. So some of the bones around the hips and some of the small toe bones, called the metatarsals, which are the bones that kind of connect the toes to the middle of the foot, are susceptible.
Okay, and I guess next question then, what would be some of the most common causes of a stress fracture?
You know, it's usually going to be something that puts more impact or load on the lower body, and often it occurs in women more than men, and the numbers are 3 to 10 times more often in females than males. And the particular sports seem to be things like running, track and field, ballet, dance, maybe those that are repetitive and require different body weights and pretty extensive training programs.
Interesting. You mentioned that women much more susceptible to this type of injury than men. Is it kind of a physiological reason there?
I think you could say that it's both a physiological and an anatomical. So the way their bodies are built, meaning women have different shapes of their lower bodies than men do, and they may put stress on bones in different ways than men. But also physiologically, women will have some hormonal changes that can influence the density of their bones or their risk of injury. And sometimes they've had periods of time where they really haven't had menstrual cycles for an extended period of time, and that can make them also at risk of having bones that weren't built up as strongly as they would be without that change of their menstrual cycle.
Talking with Dr. Scott Paluska from Oak Orthopedics this afternoon, looking into stress fractures and causes and all sorts of different issues related to that type of injury. Scott, what are some warning signs that folks will notice if they may in fact have some type of stress fracture?
You know, the stress fracture often has a pretty typical, what we call progression of symptoms. So usually, if things are just getting started, after you do your activity, maybe it's a long run, you notice some pain, and then you're noticing it with kind of moderate activity levels, and then you start to notice it with even lighter activity levels and earlier on. So you used to get it after the run, and now you're noticing it at mile 2 during the run. And then when things are really pretty far advanced, you'll notice it at rest. So you're not really doing anything, and that same area consistently feels sore.
All right, very good. And once you see those warning signs, of course, the next step would then be to see someone like yourself to get the injury diagnosed. If it is, in fact, diagnosed as a stress fracture, what's the usual course of treatment?
It depends on where the fracture is. So some stress fractures are what we call low risk or non-concerning locations, and those are usually treated symptomatically. So the first goal, of course, is to rest and to try to minimize or eliminate whatever the offending activity is. Sometimes you'll use crutches or maybe one of those walking cast boots. But certain places that are broken or have stress injuries can be very concerning, and those may be treated with surgery from the very beginning, just because the tendency may be for those to get much worse rather than better without surgery.
I guess what are some of the areas where if there's a stress fracture, what are the more common areas where you may recommend surgery as opposed to just rest?
One of those areas is what's called the femoral neck. So you think about your hip ball and socket bone, and that area where the leg bone makes the ball that fits inside the socket is a short segment of bone that's at risk. And certain parts of that bone can be broken, and they can be under tension. And if they're under tension, they're really at risk of getting worse and giving you a significant problem with the hips. So that's one area. And another area is the front part of the lower leg bone, the tibia. can sometimes get worse if this has really been going on for a long time. And then finally, one of the smaller bones in the foot, the outside of your foot, kind of that bump that sticks out in the middle of your foot, is called the fifth metatarsal. That may also get worse in some people if you don't do something to stabilize it.
All right, very good. Dr. Scott Paluska with Oak Orthopedics joining me today. Scott, if folks have any questions about what we've discussed here today, or they've got some pain issues they're dealing with and would like to make an appointment with you, what's the best way to get in touch?
Our office is at Oak Orthopedics here on Park Street, just across from the Beckman Institute, and we're at oakortho.com, or you can always give us a call at 384-8080.
All right, Scott Paluska with Oak Orthopedics. Thanks for spending a few minutes, and we look forward to talking to you again next month.
It's my pleasure. Have a good afternoon.
You too. Dr. Scott Paluska, Oak Orthopedics, my guest today. 38 degrees, 428, and we've got local news coming up next.